there, I'm Dr. Bedrick. We're here with Michaela today. So Michaela, she's getting ready for her wedding, and I just kind of want to touch up her cheeks a little bit. So here at Neoskin, what we really specialize in is natural appearing enhancement. What natural appearing enhancement means, when I go to look at somebody's face, my eye lands on her pupils first. When my eye lands undistracted on her pupil, it sends a chemical signal to the brain that says this is beauty. So when I look at Michaela, and you're how young, Michaela?
27.
27. So we have a fat pad between here and here, okay? And as we age, we start to lose a little bit of fat in this fat pad, and our skin cells start slowing down and don't produce as much collagen, so don't hold the fat pad up as much. So when I go to look at Michaela's eyes, I happen to notice a little shadow, like right here. So this fat pad, I want to kind of give it some support and kind of pull her up here. When I describe the cheek, when I evaluate the cheek, I always think of it as a Nike swoosh. Here's your apple, and here's your tail, okay? So when people go and contour their cheeks, I always call that they're contouring like the tail. But in women, as we age, we start to lose fat in our face, and we might gain it other places. Now, Michaela is very young, and I'm just starting to see a little touch of this. So, but I want her to have perfect pictures for her wedding, and I want to reduce any shadows. So by going ahead and putting a little filler, and my filler of preference for the cheek is Voluma, I would just put a couple injections in this area here, and then I'm going to treat her apple, and then a little bit starting of the tail. So you can go ahead and put that down. There is another thing that I'm always looking at, and it's called the triangle of beauty. So a small skinny chin and a high cheekbone creates a triangle that leads me to the pupil. Remember, whenever my eye lands first on the pupil, it's going to send a beauty signal to my brain. So as I fill her cheek here, it's going to add a little bit to her triangle and make it a little bit more defined. It's just going to look, I'm going to do it in a way where it's very natural looking. When somebody walks in and I look at their cheeks or their lips first, and I know lips are a sensitive thing because a lot of people are into lips right now, I always just gauge where my eye goes first. So if my eye lands on their pupil, I say that's natural appearing enhancement. You know, if I look at their lips first or I look at their cheeks first, to me that's not the look that I'm going for here at Neoskin. But you know, we are working with a patient, so if that's the look that you want to go for, that's fine. We'll work together to make sure that we get your aesthetic goals. But that's where kind of I start as a physician here at Neoskin. With this today, we are going to go ahead and use Voluma. So Voluma is my #1 selling product here at Neoskin. I always say this whole place was built on Voluma, and I always describe Voluma, it's a hyaluronic acid, so it's already naturally like in your body. In your body, it's a liquid, and what the drug companies do is they spin the liquid molecules to form a gel. It forms a cross-link to form a gel. I always try to explain, I'm very visual, I always try to explain to people that Voluma is like shaving gel. If I put shaving gel in my hand, it's a gel, but then it's going to attract water and attract air, and it's going to volumize to that shaving foam, right? So when I go ahead and put a little bit of Voluma in Michaela's cheek, over the next 3 weeks, her body is going to attract water to this product, and it's going to volumize. I love this product because it's very supportive. When I correct that, it will not only treat her under eye, her cheek, but you can see when I do this, it actually helps this little crease right here, the nasolabial folds. So I always try to start in the cheek first. So that's where we're going to start today. This product lasts about 2 years. It's not going to look brand new, as in a month it will be totally volumized. But you have a chemical, you have an enzyme in your body that will break it down naturally over time. She is going to be able to feel these, I call them like frozen peas. She'll be able to feel them, but she won't see them. And usually we're okay with that. The second week, they're going to be softer frozen peas. And the third week, she's going to wash her face and be like, oh, where are they? And she'll look in the mirror and everything will be lifted. And she'll be like, I didn't think I could like this any better, but now I do. And then at that point, we can have her come back in and see if we want to do the second syringe. Okay, we're done with a half a syringe on the right side. And so I always like to stop when I'm only doing a conservative treatment, just kind of show you what we have. So sometimes if you go ahead and lift this up and put your chin down, can you see where this is shadowy right here and flat, and this is coming up?
Yeah.
So that is where we filled, and you should see an even, the full result in 3 weeks, okay? So I think that's a really nice treatment to start with, and just kind of teach you how the treatment goes. 10 out of 10 doctors would be like, just put the whole syringe in. But my philosophy is just kind of go slow, build it up, let the client see how it works, and then we'll see you in soon if we want to put more in. Okay, so now I'm going to go on to the other side. Okay, so we're done with Michaela's Voluma in her cheek, and when I look at it, I really like the result. It is very conservative treatment. This side, on the side that you inject first, the Voluma is actually a very thick product. So when I inject first out of the syringe, I actually have to press a little harder than the other side. So this side might appear a little bit more swollen for a day or two. It really won't be noticeable to anyone else. I notice it because this is what I do. And then this side here, it doesn't look quite as swollen, but after this product attracts water, it will volumize it. And we put the same amount, a half a syringe in each side. So with that, we're going to go ahead and see you back in a month, okay?
Thank you.
So how she wants to take care of this today is she'll just ice as needed. She's not going to exercise today. That would increase blood flow to the face and might increase her swelling. Really, other than that, she's just going to monitor for any signs of infection, warmth, redness. We, knock on wood, never really have any of that, but she has the office phone number to give us a call if she has any concerns. Okay? All right, thanks.